An ideal tumor marker should possess several key characteristics to make it effective for diagnosis, monitoring, and management of cancer. These characteristics include Hack 1. 1. Specificity. The tumor marker should be highly specific to the type of cancer it is intended to detect, meaning it should not be elevated in non-cancerous conditions or other diseases. A high level of specificity helps avoid false positive results and unnecessary treatments. Harbor 2. Sensitivity. The marker must be sensitive enough to detect the presence of cancer at an early stage, ideally before symptoms appear. Sensitivity refers to the marker's ability to detect a cancerous condition in the body, even when it is present at low concentrations. 3. Quantifiable. The tumor marker should have measurable levels that can be tracked over time. Changes in the concentration of the marker can help assess disease progression, recurrence, or response to treatment. It should ideally provide a clear, reproducible measurement with minimal variation. 4. Non-invasive measurement. Tumor markers should be detectable in easily obtainable biological fluids, such as blood, urine, or saliva, to minimize patient discomfort and risk. Non-invasive testing makes routine monitoring possible and allows for frequent checks. 5. Ability to reflect disease burden. The marker should correlate with the tumor's size, stage, or extent. It should provide information about the volume or extent of the disease, assisting clinicians in staging and deciding the most appropriate treatment plan. 6. Reproducibility. The marker's levels should be consistent and reproducible across different laboratories and clinical settings. Variability between tests can cause confusion and impact clinical decisions. Therefore, reliable and standardized testing methods are essential. 7. Early detection capability. An ideal tumor marker should be able to detect cancer at an early stage, when treatment outcomes are likely to be better. It should ideally detect cancer before it causes symptoms or metastasis, offering the potential for earlier and more effective intervention. 8. Monitor treatment efficacy and recurrence. An effective tumor marker can help monitor the patient's response to therapy and provide an early indication of disease recurrence after treatment. A decrease in marker levels suggests successful treatment, while an increase may indicate relapse or metastasis. 9. Low cost and accessibility. The test for measuring the tumor marker should be cost-effective, widely available, and not require complex or rare equipment. Widespread availability ensures that it can be used as a regular diagnostic and monitoring tool in various healthcare settings. 10. No false negatives or false positives. An ideal tumor marker should have low rates of false negatives, failing to detect cancer when it's present, and false positives, detecting cancer when it's not present. This improves the accuracy of cancer diagnosis and avoids unnecessary treatments or delays in appropriate care. 11. Predictive value. The marker should be able to predict the behavior of the tumor, such as its likelihood of spreading or responding to a particular treatment. This characteristic allows clinicians to tailor treatments more precisely, improving patient outcomes. 12. Availability of standardized cutoffs. There should be well-established reference ranges or cutoffs that define what is considered normal versus abnormal for each tumor marker. These cutoffs can vary depending on age, sex, or specific population, but they need to be reliable across different demographics. Number 13. Availability for a variety of cancer types. Ideally, a tumor marker should be useful for detecting a wide range of cancers or specific to certain types, enabling a broad diagnostic application. Some markers may be applicable for only one cancer type, while others may work across several. Molecular characteristics. The ideal tumor marker should be stable and easily detectable. It should not degrade quickly and should be present in measurable amounts during the various stages of cancer progression. Also, its molecular profile should be well understood, aiding in research and development of more targeted therapies. In summary, an ideal tumor marker would be highly specific and sensitive to the cancer type, easily measurable, non-invasive, reproducible, and capable of predicting disease behavior, recurrence, and treatment efficacy. While current tumor markers meet some of these criteria, an ideal marker remains a goal in the field of oncology as ongoing research continues to identify and validate new biomarkers for clinical use.